heart rate variability training session. The key things that I want to accomplish here is to show you a little bit about the program, but I also want to introduce the importance of interacting with the clients. So we're working with computers and equipment, but this afternoon we'll talk a bunch about how to enhance your practice, and a big part of it is being genuine with your clients and explaining the things and educating your clients. So let's go ahead and do that. I recruited a volunteer. Can you come join us, please? Oh, we switched up on me. Oh. Okay. Good. Yes. Yeah.
If you're game for both, go for it.
Okay. Good. And that actually will tie in nicely to have the same person do with the neurofeedback. So things always work out. I'm going to need to just get you to slide over enough here. So this computer monitor is not going to be for you. What's your name? Julianne. Julianne, hi. I'm going to put this on your ear. So let's get a little bit of background. Ostensibly, you're here for something, and you can make it up if you like. Okay, but what we're going to do is measure your sympathetic nervous system, and I want to begin to teach you how to keep that in a nice balance, because most of us are over-aroused, and there's two parts to our system. There's our sympathetic nervous system and our parasympathetic nervous system. If you think of a car has a gas and a brake, and nobody wants to drive a car with gas only. So in life, we don't want to be driving without our parasympathetic nervous system helping us out along the way. So what would be something that we could talk about that?
Yeah, my quick elevator story would be I was a former All-American athlete in volleyball, and 8 years ago suffered a brain injury in a car accident, and I've been in therapy ever since.
Okay. So
I have autonomic nervous
Yeah.
dysfunction, and especially in the visual motor areas.
Okay. So there's a true physiological component here. I need to be respectful of that. So this is like Deanna was saying, don't just charge in, okay? So what I want to do is say that anything uncomfortable that you feel, we're going to stop right away. This is not a no pain, no gain scenario, okay? The idea is to help you be more relaxed and to feel calm. Oh.
Sorry.
Good, good. All right. So the idea is to help you feel more relaxed and calm, not uncomfortable in any manner. As a side note, if somebody has trauma and they feel too relaxed, that could be a very uncomfortable condition for them. So that can actually lead to anxiety and sympathetic arousal. So without knowing enough about you, I want to be very careful about that. So I'm going to take a few more stops and pauses in this than I normally might, okay? I actually did this once in a presentation, and the woman almost passed out on me. And she was like, oh, yeah, I've had a lot of trauma, and so I've learned to ask a little bit, not just think everybody in the room is perfectly normally adjusted except me. So what we're going to do, I just want to see your best relaxation for a few minutes. So I'm just going to take what's called a baseline, and I'm going to take some measurements. This shouldn't hurt you. I just want you to do anything you would normally do. Don't try to do anything different. We just want to see how you relax. And so what I've done is can't find the sensor. There we go. Easy fix. mistakes. You never want to get panicked when something like that happens in front of 40 people. Stay calm, do your own heart rate variability. And so I'm starting to look at things already, and this is a measurement of her pulse using the heart math program here. And I'm going to turn that sound off because to somebody who's taking a baseline, that's disturbing to get that. So heart math uses what they call a coherence ratio. That's over here. And it measures in low, medium, and high is their terminology. And you want to be in high coherence. You want to have a nice high amount of synchronization between your physiological systems. And, of course, it can drop to medium. And then also go to low. So right now, doesn't this look, oh, see, but you see what happened? Changes are happening. So you start out and she's 100% in the green. Now, she's also got me in the background talking, and I'm talking about her, so there's distractions, and that's going to change things. But isn't that perfect for our demonstration? So we see changes that are happening. These red lines are a break in the recording, meaning something physiologically happened that interfered with getting a true recording. Now that could be anything from a smile to, it could be hyperarousal, it could be tension, but it lets you know something's going on. When you have your equipment set up, ideally I can't do that here, but I want to have it set up so that I can be like this, so that I'm a coach, not that I'm just taking measurements here and looking and I don't care about what's going on over there. So,
Am I supposed to stay still and not talk and not smile and all of those things?
well, you're doing your best relaxation, so whatever's relaxing for you. Okay, so if you would be in a stressful situation, if you're upset, what would you do in order to quiet yourself down? And I'll just give her another minute. I usually run this for 3 minutes because you see a lot of changes happen. We saw she started at 100% in the green, but then that changed. Again, we can take into consideration why that changed, but let's pretend this is a clinical situation because these changes happen anyway. Okay, HeartMath has what they call a power spectrum. Essentially, what you want to do is measure their, without getting into a lot of terminology, we're just going to stick with the HeartMath terminology for here so that I'm not switching back and forth. But we want to measure somewhere in this light blue. And you can see this jumps around. And this is looking at the ratios that we talked about earlier, where if you have a very low ratio, that is usually an indicator of stress. Likewise, a high ratio, and now things are settling down here and moving into a more stable realm, the realm that we would like. And look what's happened with her breathing. So their measurement shows a very nice rhythm of heart rate variability happening. Remember, the Reflex records first, so there are going to be changes in what she's doing that are, there's going to be a delay from when the Reflex records that and sends that information to the brain, and we see a change ultimately in blood pressure and heart rate. So this can look good before we actually see a change in the coherence ratio. All right, so we're looking at very, very nice. She's stayed nice and stable. So we're going to stop that. Make sure I don't. And you can take a break. And that actually ran a little bit long for somebody that I'm taking a measurement of. I would have wanted to check in with her. You know, how are you doing? Everything okay? We good to continue? I would have been watching you a little bit more closely. making sure. And what I would have been doing is watching the rhythm of her breathing at the same time. So I'm watching, is her breathing happening up here? Is it happening down here in her belly? How quick is it happening? The last person I measured did 3 seconds of breathing in and 8 seconds of breathing out. So we knew right away that we wanted to make a change on that. A lot of people will say, oh yeah, I read about this and I do this in yoga and it's supposed to be 6 seconds in and 6 seconds out. True, that's the average, but what we're looking for is your ideal. So that's the beauty of the biofeedback here. I've had plenty of yoga teachers come in and I'm like, we could really improve that, and I think you'd feel a little bit better. So can you see over to there?
Yes.
All right. So now I'm going to do a little bit of lecture about heart rate variability. Good. All right. So what we want to do today is work on something that's been going on for ages and ages, back to when we first started to understand human physiology and think about it, even if we didn't have the terminology that we have today, we were aware of the fight or flight reflex that we have. And back in the time of the caveman, this was a very important reflex to have. It meant survival or not. Caveman's walking along looking for food, and a bear jumps out. They have to decide, am I going to try to get dinner or am I going to try to save my life? We still have that same physiology. We have not evolved very much in our brains in that regard, but we do not any longer have bears jumping out at us. So not responding to an email might look to our brain like a bear. It needs to respond. So let's just understand a little bit about how the heart and the brain are connected. I'll talk to you in a moment about the vagus nerve, but first let's understand whose job is what. So who is responsible in our bodies for our nervous system? Do you think it's our mind and our brain or our body and heart?
The body and heart.
Oh, you're so smart. Okay, yes, absolutely. And what controls our neurotransmitters? Where do you think they are controlled? Oh, so we've got a smarty pants here. A lot of people will start out with saying neurotransmitters, brain, and then organizing incoming information. They'll think the brain, but yes, your heart helps with that too. And pretty soon you can start to see everything. We're educating a patient. You're better than the average patient. So we want to be clear that the heart's not a metronome. It doesn't beat, beat, beat. There are chambers and there's a rhythmic process to it. And that's what we want to do, is we want to find your ideal rhythmic process and then see if we can interface that with the rhythm of your breathing. Those variations are important to us. That's what allows us to be as adaptable as we are. And so we're going to be taking some measurements, and ultimately what we want to do is see measurements that look nice and smooth. Most people can look at that and see that that's just seems like a better thing than that. And when we get frustrated, when we get upset, when we get worried, when anything happens that we're activating our physiological arousal, we are at risk for losing that interface in our systems. So our goals today are to understand how it affects your body. Hopefully, again, you would have come in with maybe less understanding than you have. So hopefully you already have some improved understanding of that. We're going to learn how to control your personal heart rate variability. My goal is to get you to learn something today so that when you go home, you feel like you can practice it. And practice becomes a very important component of this. Like with anything else, we can do it once or twice, but if you don't practice, it's not going to have the magical effects that it can have. And there we go. We're going to have you practice. So let's talk a little bit about how heart rate variability affects the body. The vagus nerve connects the brain stem. It swoops all the way through your body and connects to your gut. Your whole body is connected via this largest nerve in your body. So if we look here, it connects all of our organs. And we're going to look to help teach the brain, the vagus nerve, how to be more resilient and how to keep itself more quieted. So we've got the whole overview of our nervous system. And when we are activated, when the nervous system, when the brain detects that there's something that puts us at risk, our bodies become sympathetic and start to activate our organs into our fight or flight reflex. So things will happen. Our pupils will dilate. If you look at these, do any of these things happen to you as a result of what you've been through? We've got accelerated heart rate. Some people feel that.
Yeah, I'll get an accelerated heart rate. I'll have sometimes a slight urinary incontinence that just makes no sense because I'm not sneezing or coughing or anything.
There you go.
Yeah,
Okay.
the gut stuff. The gut stuff happens.
A lot of people will feel their anxiety. You know, how do you know you feel anxiety? I feel it in my stomach. So here what you want to do is help people identify, how do you know you're anxious? If I came from Mars and I never heard of anxiety, but you're telling me you have some anxiety or you have some loss of control, help me understand where that is in your body.
Yeah, and mainly if I'm really anxious, my voice, my throat constricts and then I can't speak anymore. And so I usually carry it more up here in my chest. And I'm actually a lifelong asthmatic, so I don't know if that's been a factor my whole life with my asthma, or if I actually really do have asthma. It's kind of a question I ask now.
So you have a lot of nice awareness about your physiology, and that's going to be really helpful. And that'll help us to be able to measure how this is helping you. A lot of people don't have a way of knowing if they feel better, but you're so in touch with yourself that we'll be able to tell what kind of changes you experience. You might even feel that today. You want to give a little bit of a suggestion, okay? I expect that this is going to happen. Look at how good you are at knowing yourself. Somebody as good as you is going to feel a nice effect. Sometimes, depending upon the level of the person's sophistication with you, I would talk about the amygdala and how the brain stores information and how it likes to access that file. People with chronic pain, that's an important concept for them to understand, that with chronic pain, the fight or flight system, the amygdala is super activated. It wants to protect them. All right, so now, I don't want her to see that, okay? So we took the baseline. You're good, you're good. So I want to tell you a few things that I'd like to work on. Now, she actually did very well. So I want to ask her rather than tell her, how did you do so well? What did you do to relax yourself?
Well, initially I thought I was going to see something on the screen, so I kept waiting, and so I was just, but then when you started talking, I was like, oh, I guess I'm not going to see something on the screen, so that must have been when I changed, that I was like, because, I'm just assuming I changed because you said so, and so then that made me anxious, like, I'm not going to get to see what's going on. And then when I asked, well, what am I actually supposed to be doing here, again, then I just closed my eyes so that I could just shut out everything else. And I didn't try to intentionally breathe. For some reason, I have trouble with that.
Oh, you did very nicely with it. So, closed your eyes. That's an important piece of information. When you close your eyes, if your brain is well adjusted, your alpha should increase. Okay? So, people whose alpha is not regulating, don't close their eyes. They don't like it. So that already gave me a little bit of insight, so we'll see if we see that when we get to the neurofeedback as well. Okay, but I like hearing that. I like it when somebody likes to close their eyes. And so you did a very nice job of relaxing yourself. Here what we're looking at is the rhythm as measured by the sensor that we have on your ear developed a very nice pattern. There's a little tiny hiccup in there, but that's okay. Nobody's perfect. What we want to do is get this to be, if we could get this for all the time, that would be super good. So what we want to do is get a nice measurement of understanding how long do you like breathing in, how long do you like breathing out in order to achieve this. So I'm going to have her teach me first before I start teaching her. And ultimately what we want to do, in addition to those beautiful waves that you made, is we'd like to get this peak to shift over to here a little bit. Okay. This peak, if it's quiet, or if it's low, it's telling me that your mind is a little bit talking that you were thinking, and that fits with what you were telling me. You were thinking about a lot of things while you were relaxing. And again, it's a demonstration, but this is something clients will have too. I was thinking about if I was doing it right, or I was thinking about why I can't do it. They think about a million things. So we want to get this peak shifted a little bit. So let's do it again, and I'm going to watch your breathing a little bit better this time, and I'm going to let you see the screen. And all we're looking for is to make nice peaks and valleys like that, and after we collect a little bit of data, we'll watch where the peak is there. It will move, unlike right now where it's just an average. So we're collecting, we're just getting a reading. And if you look at this over here, I usually count to myself, so 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So the out is a little bit longer, but that's okay. Just about, there you go. Nice. And I think that's happening because you're making that breath just a little bit longer. Just a little tiny bit longer. Let's keep watching. I can see she's got nice belly breath going on. So that's good. As you're breathing in, the air's going all the way to your belly, which I like. And could you put your hand on your belly so that you can feel that? Because when you're at home practicing, that will become a form of biofeedback for you. Oh, isn't that lovely? And we see the red because I had her move, so that's not a problem. We don't care about that. I made that happen. And let's have you put another hand up on your chest and see if we can create a little bit less movement on the chest and bring the air all the way to your belly. So if you could imagine, for instance, that there's a balloon in your belly, and as you're breathing in, you're filling up the balloon, and as you're breathing out, you're emptying the balloon. So the air goes all the way to the belly, and then breathe out. And I'm actually making it harder for you. I know. And if I can rest the hand there. Is it okay if I touch your bottom hand? Yes. Push our hands out. All right, and let's take take a break. And how does that feel? It's going to feel a little different. You usually don't breathe with me holding on to you.
It's hard.
Uh-huh.
I've had a lot of therapy where they've tried to retrain my breathing, and breathing was one of the first places they knew that I had a brain injury, because I wasn't breathing correctly, or whatever correctly is, or
Uh-huh.
control, whatever that is.
Okay. Okay. Do you feel lightheaded, or do you feel, so it's just hard? But you
It's the coordination of it.
feel
Like when you're
okay.
asking me to go down there, like I could actually feel, I was actually happy that I could feel my, that I could feel that.
Uh-huh.
When I put this here, that I could feel that that was actually like a huge improvement
Okay.
in general. That
Uh-huh.
I hadn't done that for a while.
And do you know, if it's hard to do, and especially if you've got other intervening variables that are definitely making it harder for you, if you can do this laying down. So if I were in the office, I would have her lay down, okay? And I might put, if it's a kid, I usually put like a stuffed animal on their stomach or something, adults, maybe a box of tissues. But when you lay down, it's easier to get that air into your belly. So when we tell people to practice at home, practice laying on your bed. Practice doing this before sleep.
Yeah, I think what I'm doing is I'm feeling it, instead of coming out, I'm feeling it go out to the sides.
I think what I'm feeling is that when you're asking me to belly breathe, and not so much coming out this way, it's coming out to my sides
Okay. Well,
versus
and
here.
do you usually feel that when you're breathing?
It may be because I'm sitting up, like, I don't know.
Okay.
Like I
But
just,
it's not a familiar feeling to you.
no.
So it's a change. And that's how we're going to get really good at this, is to see changes happening. So I don't want you to feel unhappy that you're feeling it at your side,
Okay.
okay? That's much better than feeling it up here,
Yes.
okay? So if we can get it to the side, there's no reason we can't get it to the front,
Okay.
in the future. It takes a little bit of practice, and one of the things that happens is once we have established a way of our, patterns of physiology, they're going to take a little bit of nudging to break, so that you already made a change. That's terrific.
Yeah, and I think the sitting up for me is causing me, like, my core is wanting to engage, and it's probably a protective thing. It's
Okay.
like, okay, there's a whole bunch of people out there, and so like I've just sort of armored up a little bit here. So to get it to go out towards the audience, it's like, it doesn't want to do that at all.
Well, let me ask you this. Do you have a busy mind or a quiet mind?
Very busy.
Okay. She knew that right away, okay? Not everybody knows it. Who doesn't know it are the people that have quiet minds. So, raise your hands. Raise your hand if you have a busy mind. See how fast that goes? Raise your hand if you have a quiet mind. Okay, and raise your hand if you don't know. You have a quiet mind. Okay? People don't know how anxious they are till they feel less anxious, and people don't know what a blessing it is to have a quiet mind until they don't have it. So with a quiet mind person, you can do things like start to engage emotional experiences that are pleasant. So HeartMath actually wants to teach you to teach your clients, imagine times where you felt appreciated. Imagine times where you felt really good and calm and connected. Busy mind people turn that into a nightmare. They'll be like, okay, yeah, I can remember the time I went on vacation and I felt very calm, and I haven't been on vacation in a long time. And I got to start looking at my checking account because I haven't balanced that in a long time. And they just go off and run away with it. So you don't want to do that with busy mind people. Don't give them that task. Give them a task like imagine your organs being connected. And as you're breathing, I taught you about the vagus nerve. I just want you to think about your organs, only your organs. And then ask, is that something you feel like you can stay with? If not, Imagine a whiteboard. You've walked into a classroom and the board is totally clear, there's nothing on it. You're sitting down, you're going to work on relaxation. But anything that comes in your mind is going to get written on the whiteboard and erased. Your job is to keep that whiteboard clean. That's your only job. And that keeps them busy. Okay, because the thoughts come in, they write them on, they wipe them off. If two come in at a time, they have to wait their turn. One at a time, wipe it off. And I will do the counting for you. So let's do this one final time. And here we go again.
So do the whiteboard, I'll do the whiteboard.
Yes, so now you're going to do your best relaxation. I'm going to take the microphone from you again. I'll hold it for you. And relax the hand on your chest and your belly. So go ahead and let's do that. And we've got that nice count. That was working well. I'll count it with you. In, 2, 3, out, 2, 3. And if it works for you, breathe in through your nose as you're doing, and nice out through your mouth. You can imagine there's a straw in your mouth. You don't have to blow hard. Just let the breath come out through the straw. I'm going to rest my hand on you again. And out, 2, 3. In, 2, 3. Out, 2, 3. Keeping the whiteboard empty and fill the balloon. You have 2 jobs and only 2 jobs. The air is going past your heart, past your stomach, all the way down to your belly. There you go. All the way down, passing the lungs and the heart, delivering it to the belly. And when you're ready, you can take a break. Okay. So, tell me how that was for you.
The whiteboard was impossible.
Oh, too many thoughts. We didn't like that.
I just couldn't even, well, I couldn't even see in my mind's eye. I mean, I saw this board, I couldn't really see myself, I couldn't decide, am I supposed to be sitting in a chair in front of this whiteboard? Do I go up there, do I get up every time? So then when you started cueing me into my organs, that was much easier.
Okay.
Yeah.
Okay. So, good. So we're going to work on the organs. You could see, if we want to look at her history, she actually did worse than she did on her own. Let's pull up a quick history.
Right, because the more I try to think about some task, it's,
So there's her first one, all by herself. We see some nice coherence in there. And then the second one. Pretty good, but there's some physiological disturbances in there. The sensor's just not even reading. And then we get to the third one. And not so good. There's her whiteboard, and there's what she figured out on her own. Okay. And we need to let our patients be our teachers. There is not the way to do things. Our job is to be coaches. So we have a student, we have someone we're coaching, and we're helping them find the best way for them to be successful. So hopefully that...
Now, this is an amazing lesson because many of my providers have tried to get me to just empty my mind and be in touch with my body. But my habit is to be a thinking, that's where I'm comfortable. That's where I think I'm comfortable, but evidently I'm not. Like I can see here, I am not. It's not my best state for relaxation. So you've just demonstrated to me how I must change this pattern.
Wonderful.
Break out of my perceived comfort
Yeah.
zone, that how false it is.
So what do we do with this? I'll take this off, thank you. We practice. This is not going to help you if you don't practice. We have hundreds and hundreds and hundreds and hundreds of hours of practicing being over-aroused. So we have to put many hours into stabilizing our arousal, not hundreds and hundreds and hundreds. That's the beauty of things. We can learn them. The body likes to work efficiently. When it learns to work efficiently, it's going to hold on to that. So the research on this is 20 minutes twice a day. That's what improves heart rate variability. I have had about 5 clients in 15 years that would practice 20 minutes twice a day. Don't do it. They just don't do it. But if you can get somebody to practice 3 times a day for 3 minutes a day, now you're starting to have an impact. And people will come back and say, oh, I was having a fight with my husband and I tried to do that heart rate variability and it didn't help. Of course not. You got to get good at it first, okay? You don't go to the pool and jump off the high dive before anybody's even taught you how to dive off the side of the pool. So we got to practice, and then we'll go to the high dive and take this into real life situations. So that was a great demonstration. It was, you're going to feel disturbed for a little bit. Do you have this program, or do you have a?
No, I don't.
Okay. The program itself is not expensive at all. A couple $100. Like I said, the app on the phone is very robust. So I wouldn't shy away from that. The sensor costs about $150. So what can you add to that?
Yes, I would like to add that was, thank you very much. That was a great,
Yeah.
great example. And I think it really fit perfect what we want to teach you today. Because when we talk about breathing and respiration to our clients, the other day I was telling my client, I said, okay, we're going to learn how to breathe. And she was laughing. I said, oh yes, I forgot to do that all day, right? I was like, yes, it sounds so simple, it sounds so ridiculous, it's something that we do all the time, right? But learning to breathe properly, to self-regulate, is a whole another page that we have all the background that Angelica explained us. So you need to educate the patient to understand the importance of doing it. And you saw that even a simple physiological function can be very hard. And for people that have some trauma experience, it's very difficult. It's extremely difficult to focus about their breathing, to connect with their body. And as Angelica said, we need to be the coaches. There is not a way. There is no one way that we will work with everybody. This is why you need to have very good supervision and mentors that can help you to go through case by case, and of course you build up your experience. But yeah, there are some people that if this is not working, even that you start building up, right? And it's little by little, it's baby steps, one another. This is why we have other physiological training that we can add, that we can find, that could be easier to begin. Probably somebody will be easier to start just with temperature or skin conductance, or the opposite, right? We usually try to integrate first some techniques of biofeedback and then neurofeedback. What I have lately, some patients that they are so disconnected to their body, it's so hard for them to identify their physiology that I needed to start with neurofeedback. So then we could go down to train biofeedback. So it's really very individual, and you will learn a lot with each of your patients and your clients. So it's not as easy as it looks, and you need to get the proper training and support to help people. But that was a great demonstration. So now we want to demo a neurofeedback session. Who here hasn't seen a neurofeedback session? Who hasn't? Who has not? One person. Okay. The rest of you have seen a neurofeedback session, and I know they are streaming live, so probably some people outside here, they would like to see how it's a session. So we will do a very fast demo. I know you have a lot of experience, some of you, but we just want you to demonstrate how it's a session, how it's a different equipment. Unfortunately, I don't have my equipment with me, so I will need some help here using this equipment that I'm not familiar. But the bases are the same. This is a good moment to talk about different equipments and how you can decide what equipment to use. Many people just call to ask what type of equipment you are using. If you have a successful cases, a successful practice, thank you. That means you have the right equipment, right? And we're like, no, the equipment doesn't make you a better clinician. The equipment is the least important for you to be a successful clinician, okay? All the equipments, everything will do more or less the same, okay? Everything you find in the market will do more or less the same. Some have different graphs, different games, different things, but the bases are exactly the same. So the equipment won't make you a better clinician. Your training and education will make you a better clinician. So, what size? Okay, so Juliana. We don't know what is going on in Juliana's brain, right? So I need to be very careful what I try to do, even for a demo practice. So I'm not going to do a real training right now because we don't know how she can respond, but we'll run like 2 minutes, a couple of minutes sessions so we can understand a little bit. So that's my orientation. I will prefer to have a brain map. I have the brain map with me. I have my full clinical intake, including medical records. We were talking with somebody outside in the break. It's like, how important is to know the medical background of the patient to understand if there is something going vascular, something that we don't know, and we have risk to use these instruments. So you need to have a full medical records to understand what is the medical history, risk, medications, very important what type of medications they are using. So we have everything integrated and we decide the protocol, okay? For this demo, we decided to train in CSET over the somatosensory cortex, right in the center of the scalp. And we always use, this is one channel training, it's the most simple protocol. And we always need to have at least 3 sensors connected to the patient. So we have the active electrode. The active electrode is the one that is connected to the training site, okay, the location where we're going to run the training. Then we have the reference and the ground, okay? The reference is the other channel, the other electrode where we're going to read the brain activity, okay? This is electrical activity. It has to run from one side to another, right? So we need 2 spots where it's running, and we are reading the electrical activity. And you need the ground. So Arturo is helping me to prep the skin. This is very important to have good connection. We need to make sure the electrode is well connected to the scalp. We're trying to measure very tiny activity, right? So all these conductive paste and sensor are helping us to amplify and to see a big signal so we are able to train it. So we really need to make sure that the skin is very clean. We use the proper conductant paste and the proper supplies to have good connection. It's very important to do this properly. We need to explain the patient that there is a procedure. Sometimes, hopefully not, could be uncomfortable rubbing the skin until it's very, very clean and we try to connect. Are you okay?
I'm fine.
Yeah? Okay. So right now she's all set up. She has her active electrode, her 2 reference. This is a device that the reference go in the mastoids on the back of the ears. Okay, there are some equipment that use reference on the ears or could be somewhere else in the body, but this is a more typical, the ear electrodes or the mastoid electrodes. So she's all ready, and we are going to try to read her brain activity. Okay. No problem, one, two. Can we just see the raw signal without training? Just to talk about it? Yes? Okay, so we're not training right now, right? Okay, so I can talk calm about what we're looking to the screen. Okay, so this is what you will see in most of the equipment. They will show you what you are going to train, right? So this is the raw EEG signal, and then they have the different bands here. So they divided the different bands so you can see it clearly. So when you have the raw signal, the first thing you want to see is that there is a real and clean brain activity. And real means that we don't have electrical activity in the environment that can contaminate the signal, or of course a natural artifact or contamination that is movement, eye movement, muscle tension, and some physiological functions that can interfere with the brain activity. So we need to understand what to read that, how we're looking at. So this is a whole 6 months course to learn how to read an EEG, how to identify artifacts, and how to identify if it's real activity or not. But if I ask, sorry, Julianne, that she needs to be relaxed and calm, and do you prefer to do this with your eyes open or eyes closed? Probably closed, so you don't see anybody. This is a whole other subject about training with eyes closed, training with eyes open. There are some people, for personal reasons, I prefer to do it eyes closed, eyes open. This is why when we record a QEEG, we do it with eyes open and eyes closed. This is one of the reasons, right? There are many other reasons why we need the data eyes closed, eyes open. But also it helps us to identify what would be more efficient to do the training with eyes closed or eyes open, just for the demo. And we'll ask her to close her eyes. When she closes her eyes, when the patient closes her eyes, it's much easier for us because then we won't have artifact of the eyes, well, or at least a little bit less. There are some people that when they close their eyes, they have eye fluttering, right? So sometimes it's even worse. But it looks like she doesn't have much fluttering, and she has a little bit of eye movement, not much really. So now the next thing is ask her to relax. And I know just saying this can be very difficult, right? So some people just try to relax and then the opposite. They are super tense. So you just make them feel comfortable. Try to talk them softly. Try to help them to find the comfort zone. And try to guide them in the best way so they can actually relax, right? So you have to prepare them. You need to know very well your patient to help them to find a comfortable state where they are as relaxed. And when I'm talking about relax, I'm talking about muscle relax, okay? We'll talk about later mental relaxation, but right now it's important about muscle relaxing. You need to have the proper seating for the patient. There are some people that feel more comfortable sitting straight. There are more people that reclining a little bit can be comfortable. I definitely prefer to have some support to the shoulders. So there are many people that carry a lot of tension in the shoulders, so just being a little bit supported helps them to better relax. So help them in that to find the best position, the best seat, and then probably the hardest is help them to relax their face, right? Their jaw is very easy that they get tense here, and being tense in the jaw is very easy to contaminate in the temporal lobes. Right now we won't see it that evident because we're up here. Okay, so we won't see it that evident. But if you are training in the temporal lobes and they are tense here, it's very hard to have a clean session, right? So actually, many times when you are training on the temporal lobes, the first sessions are just helping or teaching them to learn how to relax their jaw. Or probably you will start with EMG biofeedback and teach them how to relax their jaw. Later you jump into T3, T4 training. So actually she's doing pretty good in being relaxed. Now you give them instructions about helping them to find the mental strategy to have a successful neurofeedback session. And this can be a whole lecture about mental strategies, right? What they have to think about it, what they have to focus about it, what they need to try or not try about it. And you can explain in different ways, depending of the patient. But really, this is not a cognitive task. They don't have to try cognitively anything or voluntarily anything. They just need to let the brain get the conditioning and go through the session, right? For many people, this is very hard to get. They need to try something. They need to have the control of the session. They need to understand what they can perform better. So sometimes just the first 3-5 sessions is helping them to find the mental strategy so they can leave the brain do their job. Give them a specific instructions. Sometimes it's not very helpful, okay? Giving them specific instructions about, imagine you are in a very relaxing space, you are in the beach, you are with your pet, you're in a warm space. It could help them to have some ideas, but in the ideal world is try to give us less instructions so they can figure it out their own mental strategy. Eddie Dalaver, he's in University in London doing some research about phenomenology of neurofeedback, and he has a very nice study where he put 3 groups. One group, he gave them instructions, please pay attention, a lot of attention to the screen, okay? Second group, try not to pay attention to the screen, just try to think about your ongoing day, what you're going to do after here and tomorrow. The third group didn't give them any instructions whatsoever. Just sit them there, hook the electrode, leave them alone. Who do you think performed better? Which group performed better or learned better? The third one. No instructions. They figured out by themselves, okay? So this will be in the ideal world, but of course, we cannot just hook the patient and leave them. We need to give them some information. So I give them this information, actually the same that I just told you, this study, and I tell them I need to give you as less instructions as possible, and you need to figure out your mental state, your mental strategy, okay? You will have the visual cue. You will have the visual and auditory feedback. This is something very important that you need to consider when you're running a neurofeedback session. You want to make sure you have an accurate visual and auditory feedback. This is operant condition and training. And your brain needs to understand when he is in condition or not, okay? So this is why we get in some disagreement with super entertainment neurofeedback games, right? Or very busy with visual cues and auditory cues. Or just leave them the video without very clear feedback. So you need to find what is the most appropriate screen for your clinical objectives and for your client as well, right? Because there are many preferences. There are people that really get engaged in some type of screen. If it's a children, of course, we need something a little bit more entertainment so they can actually sit and perform something, right? But really, having just a green light with a beep, this is as efficient as having these very fancy video games and graphs. But just sitting an ADHD kid with a green light and a beep, they wouldn't come back after one session, right? So just try to address the screen that really fulfills the operant conditioning, the learning procedure, and that your client feels comfortable. And you can give them the options, and you never know. We have these puzzles with pictures, right? Let's say it's landscape pictures in a forest. And then my client is so anxious in a forest environment. So they're getting worse if I show the forest. So no forest. So we need to ask, depending on your options, I have this, and this. What do you think you will like and you will feel more comfortable and you like it better, right? So these are all the things that you need to consider. I'm sorry that I'm talking that much, Juliana. But well, you have here your raw signal, you have your different bands, and then you have to choose your protocol, right, based on all the information that you are gathering. The most conventional protocols, you try to inhibit some frequencies and you want to reward some frequencies. The brain learns better and faster if you tell them what not to do, but what to do, right? The only inhibition protocols, it's not that the brain won't get it, but it will take it longer to understand. So you always want to tell them, okay, you cannot do this, but you need to do that, okay? And if it's a reinforcement protocol, yes, it's okay for you to do that, but try not to do this. So you always need to have the inhibition and the reward band for the learning purpose, so the learning procedure happens faster and better. So you choose here your inhibition bands and your reward bands that I don't have idea how you choose it here.
Click on the individual parameters there. So the top one, you want theta 4 to 8.
I'm sorry. But here?
Right. Click on that.
Okay.
And then you want to inhibit it, you click on the little arrow down. There you go.
Mm-hmm.
And then this one, whichever band you want.
Mm-hmm.
And then
Your reward. Okay.
and get your beta. And then down.
Okay.
Feedback.
And right now he's training. She's training.
Yeah, there's no feedback though.
There's no feedback.
You want
Why? Yeah, hopefully. So did you see how we have the three bands, right? The inhibition and the reward. And every time here. Okay. So Juliana is seeing nothing because she has her eyes closed. Do we have audio? If the patient is going to do it with eyes closed, then she needs a very clear auditory feedback, right? So the brain gets one sensory pathway to learn. So
Do you want me to do it? I can open my eyes.
yeah, probably, if we don't get the audio. Okay, but let me explain here. You have your bands. This is also visual cues for your patient. You need to explain that these two bars, we need to have it underneath the threshold. This bar is a reward band, so you wanted to make it larger and bigger. So this is a visual cue. Before you start running the training, of course, you need to explain her what is in the screen. So they need to choose what they can pay attention or not. So they have the three bars, and then what happened in the picture? Nothing?
That's the audio feedback.
question, you're more familiar with Nexus, you use it more often. Could you come up here, please? Just to get the right screen to come up in terms of,
That's audio only on that screen.
I can't even get, I can't get back to the,
For eyes closed. Okay, so the audio is having like a relaxing music. The volume is switching, it's alternating. Okay, so the volume of this, it's conditioning to if it's in targeting and getting the thresholds in the 3 bands simultaneously for a certain amount of time, usually it's a quarter of a second, then she will get increase of the volume, right? If she's out of condition, she won't have the high volume. So you explain this ahead of time.
It's a tab key.
Okay, so the audio is a little bit low, but basically with eyes closed, this is the feedback, the audio, it will be louder or lower depending of the condition. And you just let them find the mental strategy to see if they can actually achieve the feedback. And just to give gentle reminders about being relaxed and about being alert, right? When they are with eyes closed, it's very easy to get in a drowsy state and go to sleep, but of course we want to make sure they are alert, and you can read that in the raw signal. If they are getting drowsy, you will see more higher theta activity, higher amplitude, slower, so you can bring them back to be in alert state and be focused in the music and the sound. Okay, I want to stop now here. I'm going to stop because I just don't want to do like a real training. We don't know what response you can have. But well, yes? No? Oh, choose no. Okay. So choose no. And I mean, I'm glad everybody, most of you have done a session, but I think just to have a little bit more of details or ideas. And I know every clinician has their own tricks to help the clients and the patients to perform better. It's very good because this is learning. We need to give them feedback about the session, right? Somehow or another. And you can show them the raw signal and show them what was the amplitude through the training. If the session was not as successful, try to give them, you show them the data, but try to give them like positive reinforcement. You were trying, it's a process, you will learn it eventually. It's a matter of continuous learning and try to encourage them to keep doing it. Some people, when you give them negative feedback, they feel very bad. They say, well, I cannot even learn this, I'm going to fail. So try to be very sensitive of how they can address the feedback and information. But it's part of the session to give them feedback of how they perform, what are the goals, and of course, if they did modify the frequencies in the direction we want, this is a big, big positive feedback and encourage them to keep learning. We will talk this afternoon about what you do around the session, how you need to keep progress, how you need to keep your notes, how you need to continue the relationship with the patient and all that is very important during neurofeedback. Okay, thank you very much.
couple of things that it brought to mind. Prior to getting into this profession, I was a dialysis clinic social worker, and it was impressive to learn about clients, or patients rather, that after a transplant would develop an affinity for something that the donor gave or provided. So an affinity for peanut butter all of a sudden after their surgery, and they come to learn that the donor had an affinity for peanut butter. An affinity for chess, and they'd never played chess in their entire lives, but after they got this organ, so all that to say that there's more and more evidence becoming apparent that we hold memories not just in the brain, but throughout the body. And so doing the biofeedback so that it doesn't hijack the brain is so important. It's been important for me. I'd like to tell clients, my own clients, a simple way to describe it, and I'm relatively new to this field versus some of the top brains here, about 3 years, but maybe I can bridge the gap between the general public and the more experienced folks. I like to tell my clients that it takes about this much energy, or this much energy for you to get through your day successfully. But if you're using this much energy to hold some of the tension, some of the distractions or coping skills that you're not fully aware of, then you've got this much energy to deal with this much day. And it just doesn't add up. So doing these types of exercises and making this a bit less, where we're not coping unconsciously, or maybe even legends in our own minds about what it is we're doing towards solving something, but all we're actually doing is creating tension, that it just broadens your horizons. It's a beautiful thing. I hope you enjoy your lunch. We'll need to be back here promptly at 1. If you haven't purchased the lunch, we have them available for $15 for your convenience. It's also kind of a donation to the organization. They're available by the food area. And so please enjoy, and we'll see you promptly at 1.